What is sciatica? Sciatica is not a medical diagnosis in itself, but rather a symptom of an underlying medical condition. It refers to pain, tingling, numbness, or weakness that radiates along the path of the sciatic nerve. The sciatic nerve is the longest and thickest nerve in the body. It originates in the lower back, runs through the hips and buttocks, and then branches down each leg to the foot. When this nerve becomes compressed, irritated, or inflamed, it causes the symptoms known as sciatica. Typically, sciatica affects only one side of the body. What does sciatica feel like? Symptoms. The hallmark symptom is pain that radiates from your lower lumbar spine to your buttock and down the back of your leg. The sensation can vary widely. Pain can range from a mild ache to a sharp burning sensation or an excruciating jolt like an electric shock. Numbness or tingling. You might experience pins and needles in your leg, foot, or toes. Muscle weakness. Difficulty moving your leg or foot, or a feeling that your leg might give way. Location. The pain can be felt anywhere along the nerve pathway, but it's especially common to follow a path from the low back, through the buttock, down the back of the thigh and calf. Aggravating factors. The pain often worsens with prolonged sitting, standing up, coughing, sneezing, or twisting the spine. It may feel better when walking or lying down. What causes sciatica? Sciatica is caused by something pressing on or irritating the sciatic nerve. The most common causes include herniated or slipped disc, which is the most common cause. The soft, gel-like center of a spinal disc pushes out through a tear in its tougher exterior, pressing directly on a nerve root. Spinal stenosis, a narrowing of the spinal canal, which puts pressure on the nerves. This is more common in older adults. Spondylolisthesis, a condition where one vertebra slips forward over another one, narrowing the opening through which the nerve exits. Piriformis syndrome, the piriformis muscle, located deep in the buttocks, can spasm or tighten and irritate or compress the sciatic nerve. Bone spurs, or osteophytes, overgrowths of bone on the vertebrae can press on the nerve. Other causes. Less common causes include tumors, infection, injury to the spine like from a car accident or fall, or conditions like diabetes that can cause nerve damage. Risk factors. Age. Age-related changes in the spine like herniated discs and bone spurs are the most common causes. Obesity. Excess body weight increases the stress on your spine. Occupation. A job that requires heavy lifting, twisting your back, or driving for long periods can increase risk. Prolonged sitting. People who sit for long periods or have a sedentary lifestyle are more likely to develop sciatica. How is sciatica treated? Most cases of sciatica, around 80 to 90%, resolve on their own with time and self-care. Treatment focuses on relieving pain and addressing the underlying cause. 1. At-home and conservative care. First-line treatments. Hot and cold packs. Use cold packs for the first few days to reduce inflammation, 20 minutes at a time. After 2 to 3 days, switch to a hot pack or heating pad to relax muscles. Gentle stretching. Specific stretches can help relieve pressure on the nerve. Focus on gentle stretches for the low back, hamstrings, and piriformis muscle, e.g., knee to chest stretch or piriformis figure 4 stretch. Over-the-counter pain relievers. Non-steroidal anti-inflammatory medications like ibuprofen, Advil or Motrin, or naproxen, Aleve, can help reduce pain and inflammation. Modify activities. Avoid activities that worsen the pain, like heavy lifting or prolonged sitting, but avoid complete bed rest. Light activity, like short walks, is better than inactivity, as it keeps your muscles strong and flexible. Medical treatments. If self-care isn't enough, a doctor may recommend physical therapy. This is a cornerstone of treatment. A physical therapist can design a specific rehabilitation program to strengthen the muscles supporting your back or core muscles, improve your flexibility, and correct your posture. Prescription medications. A doctor might prescribe muscle relaxants, stronger anti-inflammatories, or medications that target nerve pain, like gabapentin or duloxetine. Steroid injections. An epidural steroid injection, a powerful anti-inflammatory medicine, is injected near the affected nerve root. This can provide significant short to medium-term pain relief, allowing you to participate in physical therapy. Surgery. This is reserved as a last resort when the pain is severe and progressive, conservative treatments have failed, or when there is significant leg weakness. The most common surgery is a microdiscectomy, where the portion of the herniated disc pressing on the nerve is removed. When to see a doctor? You should see a doctor if the pain is severe or debilitating. Self-care measures don't help after a few weeks. The pain is getting progressively worse. Seek immediate medical attention if you experience any of these red flag symptoms. These could be signs of a rare but serious condition called cauda equina syndrome, which requires emergency surgery to prevent permanent paralysis. Loss of bladder or bowel control. Sudden severe pain and/or weakness in your low back and legs. Numbness in your saddle area, the area that would touch a saddle, inner thighs, groin, and buttocks. The pain follows a violent injury, like a car accident or a bad fall. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.